Welcome. In this explainer, we are going to tackle a really critical skill for your phlebotomy certification, mastering the arterial blood gas collection, or ABG. We'll cover exactly what you need to know to perform it safely and, of course, ace your exam.
Okay, let's just dive right in. The ABG is often called one of the most vital samples you can collect. Why? Because it gives this incredibly clear, immediate snapshot of a patient's breathing and metabolic status. But to get an accurate result, there is literally zero room for error. This whole procedure, from the moment you identify the patient to the final transport, demands absolute precision.
So, here's our game plan. We're going to walk through this whole thing step by step. We'll start with the basics, get into the prep work and the procedure itself, and then we'll cover what to do after the draw, how to handle problems, and finally, we'll lock in those key facts you absolutely have to know for your exam.
All right, first up, ABG fundamentals and readiness. You know, success with an ABG draw starts way before the needle ever comes out of the package. It really begins with being meticulously prepared and making sure every single box is checked.
So before you even think about grabbing your supplies, you have to follow this exact 4-step checklist. First, confirm the order and use 2 patient identifiers, no exceptions. Second, know the patient's exact ventilatory status. Are they on room air, oxygen, what's the flow rate? Third, you screen for any reason you shouldn't do the draw, like an AV fistula. And finally, you have to verify collateral perfusion. This sequence, it's a huge focus for exam questions.
And that last step brings us to the modified Allen test. This is absolutely non-negotiable. It's a mandatory step before any radial artery puncture. You're basically making sure that the other artery in the wrist, the ulnar artery, can supply enough blood to the hand all by itself, just in case something happens to the radial artery. And it is so important that you know the specific timing for what makes a positive result.
And here it is. This is the number you need to burn into your memory. 15 seconds. After you release pressure on the ulnar artery, the color or perfusion has to return to the patient's palm in 15 seconds or less. If it takes any longer than that, the test is negative. You cannot use that wrist. You have to document it and move to an alternate site.
Okay, let's move on. Once you've confirmed that the patient is ready and the site is good to go, it's time to get your equipment prepared and position the patient just right. This sets you up for the best chance of getting it on the first try.
Here's all the gear you'll need. And notice the specifics. It has to be a pre-heparinized, self-filling syringe with a safety needle plus that little air exclusion cap. Having everything laid out and ready to go just minimizes the sample's exposure to air and makes sure you can work efficiently and, most importantly, safely.
Getting the patient positioned correctly is just key. The forearm needs to be at about heart level, and that's to prevent gravity from messing with your pressure readings. Then the wrist should be extended back, maybe 30 degrees or so, usually over a rolled-up towel. This position does 2 things. It pushes the radial artery a little closer to the surface, and it keeps it stable, making it a much easier target for you.
All right, here we go. It's time for the procedure itself. We've done all the prep work, and now is when your precise, confident technique really matters. This section is just packed with exam-critical details, so listen closely.
When it comes to keeping the site sterile, you can't cut corners. You're going to clean the site with firm friction moving in outward circles, and you have to let the antiseptic work for its full contact time. Then, and this is a big one, you have to let it air dry completely. The rule is simple, and it is strict. Once that site is prepped and dry, you do not touch it again. If you repalpate, you've just contaminated the site.
Now let's talk about the angle of entry. This is so important. With the bevel of the needle facing up, you're going to enter the skin at an angle somewhere between 30 and 45 degrees. You're aiming right for that pulse you located. This specific angle is your key to a clean entry into the artery instead of, poking straight through it. So you've entered the skin at just the right angle. But what's that immediate, unmistakable sign that tells you, yes, I'm in? This is a fundamental concept you'll definitely be tested on.
And this is it. This is what you're looking for, a beautiful flash of bright red, oxygenated blood that pulses into the hub of the needle. That visual cue tells you you're right where you need to be. Once you see that, there is absolutely no need to fish around or probe any further. Okay, so you see that bright pulsatile flash. What's the next critical action? Or maybe more accurately, what is the critical inaction? This is one of the most common mistakes people make and, you guessed it, a favorite exam question.
And the answer is a big, flashing no. You do not pull back on that plunger. Do not aspirate. This is totally different from a regular blood draw from a vein. The artery has its own pressure, and that pressure is what will automatically, and pretty quickly, fill that special syringe all by itself. If you try to pull back, you can actually cause errors in the sample and even damage the artery.
All right, let's move on. The needle is out, but your job is far from over. Now we have to talk about the critical steps you take immediately after. Your job now is twofold: protect the patient from bleeding and protect the specimen you just worked so hard to get.
Stopping the bleeding, or hemostasis, is now your #1 priority. As soon as that needle is out, you apply firm, direct, uninterrupted pressure with sterile gauze. And you need to memorize these 2 timelines. For a standard patient, you hold pressure for a minimum of 3 to 5 minutes. If your patient is on any kind of blood thinner, you're holding for 10 minutes or more. And no peeking to check.
So while you're holding pressure, you've also got to handle that specimen immediately. Any visible air bubbles have to be tapped out within seconds. Then you activate the safety device on the needle, remove it, and securely cap the syringe to keep oxygen out. Gently roll it to mix the heparin, and finally label it right there at the bedside with all the required info.
Now, what's really interesting here is that how you transport the sample isn't a one-size-fits-all rule. If you can get that sample to the lab and they can analyze it within, say, 10 to 15 minutes, it just stays at room temperature. But if you know there's going to be a delay, or if the patient has a really high white blood cell count, it needs to go into an ice-water slurry. The huge exception here, if electrolytes are also ordered on that same sample, it must stay at room temperature, because chilling it can falsely raise their potassium level.
Okay, let's talk about troubleshooting. Because even with perfect technique, sometimes things just don't go as planned. Knowing how to recognize and respond to common problems is a huge part of being a professional, and it's something you'll need to know for your certification.
This is a classic exam topic, so listen up. You have to know the difference between hitting the artery and accidentally hitting a vein. Remember, arterial blood is bright red, and it fills that syringe all on its own. If you see dark, purplish, non-pulsing blood, and you find yourself having to pull the plunger to get anything, you're in a vein. You have to discard that sample and start all over with a fresh kit.
Okay, what if the patient suddenly feels a sharp pain and the blood flow just stops? That's a sign of an arterial spasm. Your response has to be immediate and decisive. Withdraw the needle, apply firm pressure like you normally would, and then maybe some gentle warmth. You absolutely cannot try to stick that same site again. You have to pick a different site for the collection.
And finally, we're in the home stretch. Let's boil this entire complex procedure down to the most critical, high-yield facts that you need to have locked in for your certification exam. Think of this as your final, concentrated study guide. This one sentence right here is pure exam gold. It sums up 4 of the most frequently tested ideas we've covered. 1. No aspiration. 2. The modified Allen test has to be positive in 15 seconds or less. 3. Your needle entry angle is 30 to 45 degrees. And 4. The sample stays at room temperature for quick analysis unless very specific conditions require it to be on ice.
And please remember, your job doesn't end when the syringe is capped and labeled. Patient safety is always the top priority. That means holding adequate, uninterrupted compression, checking and documenting the circulation to the hand after you're done, and knowing exactly when a problem is serious enough that you need to escalate it to a nurse or a doctor.
The arterial blood gas collection. It's a procedure that really tests your precision, your knowledge, and your care. By mastering all these steps, from being ready before you start, to your sterile technique, to all the post-draw safety checks, you're not just preparing to pass an exam. You're preparing to meet the highest standard of patient care. You can do this. Thanks for watching.